Hi, I'm Lila Urogdy, and I'm studying biopsychology, cognition, and neuroscience at the University of Michigan. Welcome to my podcast, Neurobites, where I break down new and significant research about psychology, neuroscience, and mental health topics in order to make research more accessible to the general public. Just a disclaimer before I start. While I do my best to keep all of my content factually correct, I'm learning with you, so there may be errors along the way or differences in the ways results are interpreted. If I say something you disagree with or believe to be false, I encourage you to reach out and initiate a discussion with me. Let's get into the episode. So today I'm discussing a study that investigates a promising treatment for PTSD symptoms. The study I chose for today is by the author of the popular book The Body Keeps the Score, Bessel van der Kolk, along with his colleagues. This study was published in 2024 and is titled Effects of MDMA-assisted Therapy for PTSD on Self-Experience. If you're interested in referencing the study for yourself at any point, which I highly recommend that you do, the link is going to be posted in the show notes. So before we dive into the study for today, what are PTSD and MDMA? So PTSD, or post-traumatic stress disorder, is a diagnosis recognized in the DSM-5. And the DSM-5 is a manual used by mental health professionals to classify and diagnose psychological disorders. According to the DSM-5, to be diagnosed with PTSD, an individual has to have experienced, quote, exposure to actual or threatened death, serious injury, or sexual violence, unquote, through either direct exposure, witnessing the event, learning about an event that happened to a loved one, or repeated exposure to the event, etc. As a result of these traumatic experiences, individuals may develop debilitating symptoms such as flashbacks, distressing memories, dissociation, nightmares, and avoidance of stimuli related to the trauma. It is important to note that not everyone develops PTSD after experiencing a traumatic event, so some people are more resilient to the disorder than others for reasons that I can go into in later podcast episodes. So, what is MDMA and why are researchers exploring it as a treatment for PTSD? Well, van der Kolk and his colleagues explained that the first line of treatment for PTSD is often some form of psychotherapy, which hasn't proven to be largely beneficial because, quote, reduced self-capacities, unquote, such as difficulties with emotional regulation and low self-compassion, can interfere with successful completion of these therapies. So basically, certain things get in the way of completing psychotherapy, which means that psychotherapy hasn't proven to be largely beneficial yet. So MDMA is being explored because it's known to both improve emotional regulation and self-compassion in healthy individuals. So the researchers of the study basically wanted to see whether MDMA can improve these things in people with PTSD so that therapy can be more effective in treating the PTSD symptoms. So MDMA is short for an extremely long name that I'm not going to attempt to pronounce because I will butcher it, but it is commonly known as Molly or ecstasy. MDMA is a drug with both psychedelic and stimulant effects, so it works by increasing the activity of the neurotransmitters dopamine, serotonin, and norepinephrine by facilitating their release, as well as inhibiting transporter proteins that normally remove them from the space between neurons. And the space between neurons is called the synaptic cleft. So, in short, MDMA enhances the activity of these neurotransmitters through certain mechanisms that I explained. So as the title suggests, this study evaluated the efficacy of MDMA with talk therapy in treating PTSD symptoms. The researchers' specific goal was to determine whether the treatment would lead to greater improvements in patient self-experience when compared to a placebo. And in a few minutes, I'll get into the methods that the researchers used to measure this and the limitations of this method. So the participants of the study include 90 adults with a PTSD diagnosis according to the DSM-5. Typically, when choosing participants for a study, there's something called exclusion criteria. And exclusion criteria are things that make someone ineligible for participating in the study. So in this study, the specific exclusion criteria included certain things like psychological and physical comorbid diagnoses such as bipolar disorder, personality disorders, substance use disorders, certain medical conditions, etc. MDMA is known to raise blood pressure and heart rate, so people with heart conditions weren't included in the study. And so basically, regardless of how effective MDMA is, this excluded population of individuals with heart conditions might want to look for other treatments because MDMA could pose a risk to them, and it hasn't necessarily been studied in these populations for PTSD. Additionally, because of the exclusion criteria, the study doesn't look at the effects of MDMA treatments in people with PTSD and comorbidities, so that might be an avenue to explore in the future. So basically, if someone has PTSD and bipolar disorder, they weren't included in the study, and so we don't know how effective MDMA-assisted therapy would be in these populations. So among the participants, 65% of them were women, 80% were white, and 70% were college graduates. I actually looked at the corresponding numbers according to the U.S. Census Bureau. So in 2024, approximately 50% of U.S. citizens were women, which would make sense. About 70% were white compared to the 80% in this study, and then about 35% had at least a bachelor's degree compared to the 70% which were college graduates in the study. Because the demographics of the study participants don't match those of the U.S. population, the results might not be generalizable to the general public. The paper does claim that no statistically significant differences were found between the treatment and control group in these demographics. So this would mean that variables like sex, race, and education didn't seem to confound the results of the study. However, there weren't any p-values listed, and I couldn't find a table of the actual demographics anywhere in the paper to confirm this, so I can't really say for sure if this is true or not. I would hope that they would be, and these are pretty reputable researchers, so I would assume that they would be honest and open with their results, but there's just nothing to back this up in the paper. I also want to mention that follow-up data from 8 of the 90 participants were missing, and the researchers in the paper explained that the data from 3 individuals that were missing were due to COVID-19 related reasons. Data from 4 individuals were missing because these individuals chose to stop treatment, and then 1 person resumed another treatment that they had been on before the study, and so this data couldn't be included in the results because that other treatment would have affected the results of the study. After participants were selected based on the criteria created by the researchers, they were divided randomly into 2 groups. One group received the psychotherapy with MDMA. The other group received psychotherapy with a placebo. For those of you who don't know what a placebo is, it's basically a fake treatment that the control group takes that looks like the actual treatment so that neither group knows whether they're in the treatment group or the control group. And really common placebos are things like sugar pills or saline injections or stuff like that for drug studies, just depending on the type of drug being studied. I don't think this paper mentioned exactly what they used for the placebo. It might be there somewhere, but I missed it. So I can't necessarily tell you what the placebo was. And the point of using a placebo is to minimize any self-report bias. So typically in a study, if a person knows that they are taking the actual drug, they might perceive that they are benefiting more just from psychological effects. This is typically called the placebo effect, where you're taking a placebo, but you think it's the actual drug, and so you think you're improving. But it's just your mind playing tricks on you, basically. And so this study wanted to minimize any self-report bias, and this is referred to as a blinded study. So the participants are blinded to the treatment that they are taking. To further protect against bias, some studies are also double-blinded, where both the participants and the individuals analyzing the data are unaware of which group is receiving the treatment, and this study was double-blinded. So after the participants were divided into the groups, everyone in both groups went to 3 90-minute therapy sessions in preparation for the experiment. After the 3 prep therapy sessions, all participants went to 3 psychotherapy sessions, each about 8 hours, with about a month in between each one. Now, 8 hours does seem like an insanely long amount of time, but I will go a little bit more into what happened during the sessions and kind of explain that. I would be interested, though, in seeing how effective a shorter session would be, because I don't think an 8-hour session is necessarily realistic for most people who want to treat their PTSD symptoms. So it might be interesting to explore shorter treatment sessions in the future. But anyway, the treatment group received an initial dose of MDMA as well as a half dose about 2 hours in the experimental sessions. And then the placebo group, the control group, also did the same thing. They had the initial dose of the placebo and then a half dose about 2 hours later. And during each session, food and fluids were provided, so these patients were not starved to death. Additionally, during the sessions, trained therapists were instructed to listen, respond, and provide support to the participant. And to ensure that the therapist followed the proper protocol, sessions were recorded and analyzed. I would assume that having their sessions be recorded might have been pretty uncomfortable for some of the participants, and so this probably made them a little bit wary of what they discuss with the therapist. I don't know how this affected the results in any way, but at least it was consistent across the groups, so it wasn't necessarily something that was affecting the differences in averages between groups. After each session, participants stayed overnight and attended a, quote, integrative session, unquote, in the morning. They also attended 2 more integrative sessions, each spaced about a week apart. So 3 after each experimental session, and so this is 9 integrative sessions in all. And these integrative sessions consisted of 90 minutes of psychotherapy without MDMA, with the purpose of processing the experimental session and preparing for the next experimental session. After all of this experimental sessions and integrative sessions were complete, the researchers followed up with the participants to assess the outcomes. So how did the researchers measure so-called self-experience? Well, they used 3 scales, and they compared baseline measures to follow-up measurements. One of the scales that they used is called the Toronto Alexithymia Scale, or TAS-20, and this scale evaluated alexithymia, which is basically how well someone is able to recognize and articulate their emotions. Participants responded to prompts on a Likert scale from strongly disagree being 1 to strongly agree being 5. A Likert scale is basically a way to measure qualitative data, such as opinions and attitudes, in a quantitative way. So basically saying, how much do you agree with this, and then putting a number and a scale to it. So in this case, the scale was 1 to 5. I looked up the TAS-20 scale to get an understanding about the types of questions it asks, and I do admit I'm a little bit skeptical about the validity of the scale because some of the prompts are a little bit vague. One of them was, I don't know what's going on inside of me. And this question could be interpreted in so many ways, like in terms of emotions, feelings, physical sensations, or like actual biological processes. Another prompt I didn't necessarily like was looking for hidden meanings in movies or plays distracts from my enjoyment. So from my perspective, this prompt could be taken one of 2 ways. The first is you either do or do not look for hidden meanings in movies and plays. And the second would be that given that you do look for hidden meanings, does it distract from enjoyment? So my question would be, how should someone respond if they do look for hidden meanings, but it doesn't distract from enjoyment? In other words, what is the prompt really focusing on here? It's not exactly clear. But anyway, using the TAS-20, researchers found that the participants in the treatment group experienced a statistically significant greater change than the control group in self-reported alexithymia, with a p-value of less than 0.001. P-values are basically a way to determine whether there is statistical significance in the difference between group means or proportions. So typically the threshold is set at 0.05, and calculating a p-value significantly under the 0.05 threshold, as was found with these results, indicates that the differences in results between groups is likely due to true differences among populations and not merely random chance. This low p-value suggests that MDMA in conjunction with psychotherapy likely improves patients' ability to recognize and verbally articulate their emotions. A second scale that was used was the self-compassion scale, or the SCS, and this scale utilizes prompts with a Likert scale from 1 as almost never to 5 as almost always to evaluate how someone sees and responds to their own shortcomings, failures, and suffering. So sample prompts for the SCS include things like, I'm disapproving and judgmental about my own flaws and inadequacies, and when I feel it's something important to me, I try to keep things in perspective. So these are just some examples of prompts that were included in the SCS. Using the SCS, the researchers found that MDMA-assisted therapy significantly improved self-compassion scores from baseline measures compared to the control group with a p-value of 0.0001. So this suggests that MDMA-assisted therapy can improve PTSD patients' self-compassion. And again, this p-value is well below the threshold of 0.05, so this suggests very significant results. The third scale that was used was the Inventory of Altered Self-Capacities, or IASC, and the IASC measures the participants' overall functioning in terms of things like interpersonal connections, self-identity, and emotional regulation. The scale uses prompts with a Likert scale from 1 being never to 5 being very often. I was unable to find the IASC online and read the prompts because I'm pretty sure it's only available to professionals who pay for it, so I would assume that it's a bit more in depth than the other two scales I mentioned, but I can't provide any example prompts that are part of the IASC. The paper does mention that there are 11 subscales, which I'm not going to list out for you, but if you would like a more detailed understanding of the IASC, feel free to refer to the paper. So, the researchers found statistically significant improvements in the experiment group compared to the placebo group in all IASC subscores except for identity diffusion. The paper didn't specifically define identity diffusion, but upon further research, my understanding is that identity diffusion is a psychological phenomenon where basically an individual hasn't yet developed a strong sense of self. The results from the IASC suggest that MDMA in conjunction with therapy can improve some but not all aspects of psychological functioning in individuals with PTSD. All in all, after controlling for changes in PTSD scores, there was no statistically significant difference in any of the self-experience measures between the treatment and control groups except for self-compassion scores. So what this means is that the improvements in the PTSD symptoms were mediated by these improvements in the self-experience scores, except for self-compassion. So this is really good news because it means that MDMA-assisted therapy seems to be a promising treatment for PTSD in that it can help certain aspects of psychological functioning and self-experience that allow for improvements in PTSD symptoms. Overall, I think these are really exciting results. MDMA-assisted therapy seems to have a positive impact on patient outcomes and could possibly be the future of PTSD treatment. Because the demographic information doesn't match that of the general population, and MDMA could potentially be harmful for individuals with heart conditions, it's important that further studies are done to evaluate how effective the treatment protocol outlined in the study is for these other populations. Additionally, this was a short-term study with only 3 experimental sessions, so I might be interested in seeing where more MDMA-assisted psychotherapy sessions could have an even greater improvement on patient outcomes. So could having 5 or 10 or ongoing MDMA-assisted therapy sessions have an even greater impact on PTSD symptoms? Or could there be any potential side effects to this? And then again, the 8-hour sessions, in my opinion, are a bit long. So what could a shorter session do? If you had an hour session, could that be effective? Or what's the threshold for having an effective MDMA-assisted therapy session? That's it for today. Thank you so much for listening to this podcast and expanding your knowledge of psychology, neuroscience, and mental health topics. I'm so grateful for the opportunity to learn alongside you. If you have the chance, please rate and review this podcast, share with a friend, and let me know what you want to learn about next.